Ontario is home to 482,665 people who arrived in Canada as refugees, and this accounts for 56% of Canada's refugee population. Refugees are newcomers who have been forced out of their home countries due to persecution that puts their lives at risk, which can contribute to experiences of trauma at all migration stages. Approximately 70.6% of this population speaks non-official languages, highlighting the potential access barriers to comparable opportunities for improving their mental health literacy. In fact, many times the first contact with mental health services post-settlement is either in the hospital emergency room or the correctional system. To effectively promote mental health literacy among Ontario refugees, it is imperative to provide resources that are affirmative, transculturally adaptable, trauma-informed, and accessible. With the evolution of information communication technologies, this is where the Ontario Refugee Health Self-Advocacy Portal, or ORHSAP, comes into play. ORHSAP is a web-based mental health portal that aims to provide refugees with access to centralized information on Canada and Ontario's mental health system, mental health and illnesses, treatment approaches, early intervention, and the laws regarding rights as a client to help refugee Ontarians discuss mental health with family, friends, community members, and service providers with greater confidence. ORHSAP will strive to provide visitors with an opportunity to understand mental health in a way that is informed by evidence-based practice and transcultural considerations of mental health. Visitors will have access to this service in their language of choice with the option for audio and video delivery of information, with videos including community leaders and health professionals with experience working with refugees, helping to normalize mental illness as a social problem affecting everyone. The development and launch of ORHSAP will consist of 4 steps. Step 1 will involve partnering with nonprofit organizations and community leaders already engaged in this work. Step 2 will involve the pursuit of funding, with part of this coming from in-kind contributions from university and hospital partners, pursuing internal funding within partner organizations, and external funding opportunities at the federal level. Additionally, the 2019 Ontario budget highlights 2 action items that align with the mission and values of ORHSAP. This means that through funding support from the Ontario Ministry of Health and Long-Term Care and the Ministry of Children, Community and Social Services, ORHSAP could work with the Ontario government to provide mental health supports to refugees that is both affirmative and interventional while meeting their goals of efficiency. Step 3 would involve establishing an advisory board that includes members who are hospital or community agency leaders, members of religious institutions, and refugee Ontarians who would consult the research team, establish task forces into segments of the population, and hold final approval for decision-making with the development and launch of ORHSAP to ensure the upholding of the interests of service users. Step 4 would involve the launch of ORHSAP and its research and program evaluation initiatives. In launching ORHSAP, we would aim to target early adopters such as organizations and associations with position statements on the promotion of mental health literacy. This could include various mental health professional associations, the Ontario Hospital Association, and Community Care Ontario. Research would also involve the implementation of a randomized control trial study evaluating the effectiveness of an internet mental health literacy intervention for refugees in urban and rural Ontario. The program evaluation initiative would be another way for us to determine if we are meeting the goals of this partnership, primarily through decreased emergency hospitalization entries and length of stay, in addition to increased utilization of community mental health supports, all of which would be investigated through the use of the Institute of Clinical Evaluative Sciences data. This social innovation has the potential to disrupt our current mental health system and its current mental health literacy strategies by providing refugees with opportunities to promote self-efficacy when working with health professionals and to decrease the reliance on Ontario's overwhelmed hospital service systems, including emergency services, which can contribute to a social return on investments with decreased hospital and correctional mental health spending. The incremental improvements could lead to a long-term impact of having a mental health system in Ontario that helps refugees to promote their own mental health and effectively live within their own communities, ultimately contributing to a healthier Ontario. To learn more about this social innovation, visit us online at www.orhsap.ca.